Support for Radio Friends comes from Columbia Healthy Smiles, the dental office of husband and wife team Dr. Batson and Dr. Abe, offering comprehensive and customized care to patients of all ages. Learn more by calling 573-721-9039 or online at www.columbiahealthysmiles.com. Good morning and welcome to Radio Friends on Wednesday, October the 6th. I want to introduce you to a brand new guest on our show, Dr. SHELLY FARNAN, and she is with the Burrell Community Center, Burrell Center here in Columbia. And some people may not be familiar with the Burrell Center. Why don't you explain what it is?
You bet. So Burrell Behavioral Health is the community mental health center, privileged and honored to work in several regions throughout Missouri into Northwest Arkansas, and specifically our central region here. So Burrell has been around for approximately 45 years.
45 years?
Yes. And more recently well known in our central region of Missouri in the past 10 to 15 years.
Yeah. Now, you're pushing Be Well. Be well. You want everyone to be well.
We sure do.
How? How are you doing that?
So Burrell has been around for 45 years offering those traditional mental health treatments, care, services, and therapies. And in the past couple of years, Paul, especially as a result of COVID-19, we have launched into the prevention, health, and community wellness spaces with the Be Well community. And now coming up is the Be Well community movement that will be coming to us. So here's what we do. In March of 2020, much like every one of us listening here today, our leadership team was trying to figure out how do we support the emotional and brain health of our own Burrell colleagues. I received a text message on March 16th of 2020 that said, we need a proposal for an employee health wellness support activity or group or something. Alongside the team of about 5 to 10 of amazing colleagues, 5 days later, we proposed the Be Well community movement, now known as Be Well initiatives. And that was launched, yes, for our Burrell colleagues as well as for the greater community as well. So we're in now week 79 of Be Well initiatives, and that has essentially 3 components to it. So we have that internal wellness component for our Burrell colleagues. We do that live on Facebook for anyone in our community that is now coastal. We have folks joining us from the east to the west coast live on Facebook. It's free. You don't have to be a Burrell client or receiving care at Burrell to participate in this wellness movement. And then thirdly, we started noticing that private organizations were reaching out to us. So the first arm or additional arm or expansion of Be Well initiatives has been for Be Well for Business that has launched in the past 2 years.
How has the COVID pandemic affected our mental health as a whole?
So COVID is affecting all of us. So many times we hear, I've never dealt with mental health illness, mental health symptoms until COVID-19. The interesting thing about COVID-19 is that it's not, none of us are removed from it. We all had to be isolated. We all had to change what our daily lives look like. We're grieving, quote unquote, normal. I don't even know that we know what normal is anymore, Paul. And so what we're seeing is so many of us are reporting mental health illness that have never reported mental health illness before.
Has anything good come out of this? And I don't mean that in a sarcastic way at all, because this COVID it's awful. It's been horrible. But has any good come out of the fact that maybe we have all been forced to slow down a little bit and not try to do as much as we have in the past?
The fact that I'm able to sit here with you today to talk about Be Well initiatives. Be Well initiatives is a brain health wellness program that everyone is asking for. Individuals are asking for this. Families are asking for this. Community organizations, businesses are now asking for this. For so long, we were taught that brain health and mental health stops at the door of whatever we walk into, work or church or home. You leave that at the door. And what we know is that's not possible. All of us have a brain, which means our brain health walks around with us everywhere. So as you ask what positive has come from this, we're having to talk about brain health. We're having to talk about emotional health and wellness. And I would say that's positive because we've been missing that mark for far too long.
Why do you think people don't like to talk about emotional good health?
There is so much stigma associated with brain health. Even calling it mental health insinuates a stigma. It's brain health. Any other...
You're calling it mental health. It assumes that you have a problem.
Yeah. And when we talk about brain as an organ, we have brain health. All of us have brain health. But when we say mental health, we often think, oh, them out there with mental health illness. No. All of us have brains.
Okay, so how do we improve our brain health on a daily basis?
Here's what we're inviting you to do with the Be Well initiatives. We're inviting everyone to make it simple again. Get back to the basics of what brains need to survive. And first and foremost, we need safety and we need healing connection with other people. So Be Well Initiatives is launching the Be Well community movement, and we're inviting folks to participate. While the Community Mental Health Center will be around for our communities forever, we will provide service and care forever. We also know that it's going to take our entire community to truly improve the overall health and wellness of our community.
And how do we do that in a community? I mean, that's a big task.
We join the Be Well community movement. We sign our organizations up. We ask for these Be Well experiences to come into our workplaces, into our faith-based systems, into our schools. We bring brain health into every location.
What can somebody do listening to us right now to improve their brain health? If they want to do something at this very instant, what can they do? What's the best thing?
Best thing in this very moment for anyone, especially anyone driving right now, 3 deep belly breaths. That would be the best thing that anybody could do for their brain health in this very moment.
Why is that?
Because it oxygenates our entire system and gives our brains this window of opportunity to make the next best decision.
So what if you sit down 2 or 3 times a day and just take in 3 deep belly breaths? That's what you call them? Mm-hmm. So inhale, till your stomach goes out.
Clear into your diaphragm.
Yeah. Mm-hmm. Do that 3 times, several times a day, and you're going to feel better.
Lots of times a day. You can't just do that, though, Paul. It has to be in healing connection with other people. I would recommend we do that, and I would also recommend that we're joining community movements in which brain health is the focus.
Okay. If people want more information, you have a website? Where can they go?
We certainly do. Be Well Initiatives is present on every one of the major social media outlets. I would first recommend that we check out bewellcommunity.org, especially as we're launching Be Well Bells into each of our regions. So we are partnering, pulling out all the stops to create innovative, meaningful partnerships with artists, and we're actually going to be creating bells that are going to come to life in our community. So anybody that walks by at 3 a.m., there's going to be a code on those beautiful bells, and you're going to be immediately connected to resources.
Thank you so much for coming by. All right?
Thank you, Paul.
If something you'd like to hear or see, I'd love to hear from you. Drop me an email, pepperp@missouri.edu, and be well. Okay?
Be well.